Well, good evening, Mr. Speaker and my friends. We have just heard from the Democrats talking about their new foray into solving all the problems with health care. And boy, did it sound good to me. I have to say it really sounded good. The promises, essentially what I was hearing talked about was, first of all, the costs are coming down, and you're going to get free medical care, and the quality of the care is going to go up. And gosh, if you were given a proposal like that, I don't see why anybody wouldn't say, yeah, let's just march right ahead with socialized medicine. Let's let the government run it because they're going to bring the cost down. They're going to give you free medical care, and you're going to get even better coverage than you get now. I also was hearing the fact that they talked about the muck of our healthcare system and how bad the healthcare system is, and how if we don't immediately pass this legislation, that things are going to get even worse. And but what we have in front of us is this absolutely euphoric view of a great healthcare system. Well, first thing off that strikes me is a little bit of problem with common sense. The first is that if our healthcare system were so bad, then it would seem like to me that Americans would be going to some foreign country to get their health care. But what I'm observing is that if I got sick, and I have been sick, the place that I'd like to be treated is in good old USA. I don't want to go to Canada. I don't want to go to Great Britain. I don't want to go to France or Sweden. I don't want to go to Russia. No, I'd like to be sick right here in this country. And so it strikes me that a healthcare system that most people, even around the world, recognize as probably the most sophisticated and the best quality healthcare system in the world, we're saying that it's full of muck and that the system has to be completely changed around. And so it's okay if you want to believe these promises that what's going to happen when the government takes over the healthcare system is that it's going to cost less money. The trouble is the Congressional Budget Office doesn't say that, and the estimates of the costs don't say that, and the states that have tried using the same approach that's being proposed here nationally, they don't say that either, because those states are almost bankrupt for trying to do this kind of a system, and yet we're going to try to copy those bad examples. We are just actually a few weeks, a couple, 3 weeks away from dealing with the other big problem that the administration's identified, which is the fact that the climate in the earth is going to get worse and worse, hotter and hotter, and we're going to melt down. And so we've got to deal with the problem of global warming by, of course, what would you expect? A very, very large tax increase, the largest tax increase in the history of our country at about, I guess it was about $787 billion. That was the largest tax increase that we've done. We did that. It was a 1,100-page bill that was brought to the floor. And then at 3 o'clock in the morning, in a special committee hearing, another 300 pages of extra text were added to the 1,100 pages, and the 300 pages being in the form of amendments to had to be collated and put into the 1,100 pages. So as we were debating this wonderful bill on the floor, they were busy trying to collate this amendment that had been passed, 300-page amendment, at 3 o'clock in the morning. They're busy trying to collate that. And so as we're debating it here on the floor, about to take a vote on it, there isn't even a copy of the bill that we're going to vote on. And so here we go again, and not having, or perhaps we did learn from our last experience that it's easier to pass something that people don't know what it is. And so here we go now with about 1,000 pages of bill in terms of what we're going to do to have the government take over 20% of the U.S. economy. The healthcare business is about 20% of the money that's spent in America. It's about 20% or close to it of our economy. And now we're going to have the government take, well, if you take a look at it, about half of it the government's already running with Medicare and Medicaid. So we've had some experience with the government running these programs. The Medicaid program, of course, is noted for the tremendous amount of fraud and abuse that it has. But if you add the Medicaid and Medicare money, if you take a look at the total money we spend on healthcare, government's doing about half of it right now. But we're talking about having the government do the rest of it. And so that's where we're going. And I think we need to take a look at that. When the government does take over various things, what tends to happen? Is it noted for its efficiency? Well, usually what happens when the government takes over programs is you get a tremendous excess in amount of spending. You get a lot of bureaucratic rationing. These are typical things in government programs. There's an inefficiency and a degraded quality. Those are the kinds of things that history would tell us happens when the government takes something over. That's what's being proposed here. Make no doubt about it. What's being proposed is the government is going to take over the healthcare system. And so that has left people with this particular quip that if you think healthcare is expensive now, just wait till it gets to be free. Then you'll see what real expense means. Well, let's take a look at how well this has worked in the past. That one way you can tell whether it's a good idea to make a move or to do something particularly is to take a look at other people who've tried the same thing. The state of Massachusetts decided in 2006 that they were going to require universal health care coverage. It's very much like the current Democrat plan, and where people are required to purchase specific levels of health insurance. Well, here's what happened. Health care costs have risen 42% since 2006. 42% increase. Now, we were just hearing from the Democrats that this thing isn't going to hardly cost anything. It's going to be a break even because there's so much efficiency. Well, what sort of efficiency is a 42% increase? And yet, healthcare access is down, and the patients have to wait more than 2 months to try to get to see a doctor. So is this the kind of thing that we think is going to improve what most people think is the best healthcare system in the world? And healthcare costs now, up in Massachusetts, they're 133% of the national average. Well, that doesn't seem to me to be producing these glorious results that I'm hearing the Democrats talk about. I just don't think that these people may have gotten over their euphoria from just managing to put 1,100 pages with 300 pages that nobody could read or know what it was, and pass that within a day of the 3 o'clock in the morning when they made the amendments. So here we go again. We're going to see if we can't pass another, going to be 1,000 or 2,000 page bill this year. This week or next week. And it's a lot easier to pass them when people don't read them.